The American Public Health Association's 2023 Annual Meeting and Expo is the premier public health event of the year, offering innovative and exciting opportunities to help members reach personal and professional goals. And we are here covering every angle.
You're watching APHA TV.
This is APHA TV.
APHA TV starts right now.
Welcome back to the Georgia World Congress Center in Atlanta and to APHA TV. In this episode, we're shifting the focus to public health in America today.
Do you want health or health care? And what we're saying in this country is actually, since we don't have universal health care, we have neither.
It's a pressing public health emergency, the declining health of the U.S. population. We will sit down with experts to discuss what's at stake.
Working together with federal, state, local public health officials, internationally as well, that we can address the challenges that we face now and in the future.
And it's our must-see sit down. U.S. Assistant Secretary for Health, Admiral Rachel Levine, joins us in the APHA TV studio.
Or too often, we have believed we could go into a community and tell people what they need to do without understanding there is enormous wisdom in communities that we too can learn from.
Plus, we pick up our tour around the nation of those fighting on the front lines to make this the healthiest nation. We've got a lot to cover and plenty of ways for you to watch. You can always find the latest APHA TV episode playing on the TVs throughout the convention center, on the in-house channels at several of our partner hotels, on the APHA website where you can click through the video playlist to find even more exclusive meeting content, and on our YouTube and X pages, formerly known as Twitter. We start this second day by hearing from you. We hit the floor to talk with attendees about what you hope to take away from this year's gathering. Let's find out.
What I love about APHA is it brings together, first of all the states as well as other countries. The opportunity for all the breakouts and all the different interest groups and committees and so forth to meet is super important to get the work done. To me, it's a shot in the arm every year to come to APHA and be able to see folks that are out there every day working to improve health.
So this is my 22nd APHA annual meeting in a row. This is really the premier place for all of us that are wanting to advance the cause of health equity to come together. I'm here with 8 of my students to really understand how important public health is right now. It's just a life-altering event when you're doing it for the first time.
I will be graduating soon from high school, so I'm really excited to meet new people, learn more about public health and non-communicable diseases, and I feel like I might get an amazing experience because there's so many people. It's not only nationwide, it's international.
It's really great hearing different perspectives and how we can make each individual community stronger, but overall stronger together. I want to get into PA school later on in the future, so being an ethical healthcare provider is something that I can really gain from coming to APHA this year.
Public health requires constant learning, so we have to be able to meet amongst ourselves, chat with our colleagues, hear about the latest innovations, and understand the evidence and the science so that we can incorporate those things into our policies, and this is a great place to do that.
We serve people, all diverse populations, so just to be able to learn strategies, just to be able to network and see some of the best practices, I think that's the main reason for coming here.
I got really excited working in a public health job for the first time this past spring. Really excited just learning about all the different sectors in public health, all different people from all over the world, and just having a good time, honestly.
Atlanta's really the capital of public health, so it's fantastic that the APHA is here. We just have so many wonderful institutions that are putting public health into action.
We have the CDC in our backyard, the birthplace of civil rights. I think it's a very important symbolic place for APHA to be. Really, while we're reimagining what public health looks like in this political, social climate, I think there couldn't be a better place than Atlanta.
In Northern Kentucky, the Institute for Health Innovation works with those hardest hit communities to provide solutions to chronic illness. Its comprehensive health program aims to recruit a new generation of healthcare workers, and its essential preemptive education serves underserved students.
Substance misuse and abuse has been quite a challenge in the United States for many years. Kentucky, like unfortunately its neighbors, West Virginia and Tennessee, tend to be a hot spot. When I first started working here just 5 years ago in Owen County, there was no hospital there, there's no urgent care. A huge issue is transportation. And unless you own your own car and your car runs, then it's very difficult to access anything. So what we're trying to do in Owen and Carroll County is build everything all at once. So the first thing we did was hire care coordinators. We've also started some programs in schools because the best way to alleviate substance use disorder is to try to prevent it before it begins. We've also now have a group of youth mentors who reach out, help, support, as well as refer people to what sort of services might be available in their school.
As we focus on public health in America today, we turn to some sobering statistics. Compared to other nations, Americans' health is in decline. Life expectancy began dropping prior to the COVID-19 pandemic and has only continued. So how can we reverse the trend? APHA leaders discuss.
Health in the United States is facing a real crisis. That is, the length of life, how many years we live, is declining, and it has reached the level now where it was in 1996.
For a long time, the U.S. has attributed its poor health outcomes to the terrible conditions and health outcomes, particularly of African Americans, but all in general, people of color, Latinos, indigenous people. But now we're seeing this affecting everyone.
The United States spends more on health care than any other country in the world, both in aggregate and per capita. And still we have these terrible health outcomes. One lesson from this is that health is about more than health care, that spending on health care doesn't solve our problems. We do need to improve access to health care.
Our healthcare delivery system is profit-driven. It is not something that rewards the achievement of health. It's something that rewards the accrual of profits. And it's time for us to start talking about this.
Do you want health or health care? And what we're saying in this country is actually, since we don't have universal health care, we have neither.
What to do about people who can't afford or aren't eligible for healthcare insurance, and that's when it's time to start talking about why we don't follow the lead of every other wealthy country and guarantee access to healthcare services.
We've found more than 50 countries that have outperformed the United States on life expectancy. 17 of them have done so for more than 50 years. We need to study some of the policies that have enabled those countries to produce better health outcomes for their population. They include things like social welfare programs, better regulations on products and services that are dangerous to health, better access to health care. We need to follow their lessons, Americanize those policies, and see if we can achieve something closer to the outcomes they've achieved for so many years.
The important thing is to look to our society as a whole, to think about how well we're doing at protecting a decent everyday life. How well are we doing with wages? How well are we doing with access to affordable, decent housing? So those are all things that affect our health, and they're affecting health outcomes.
Most Americans are not aware of being dead first. And so what we need is something like what happened in 1957. We set a goal to land a human on the moon by the end of the next decade. We could set a goal to become one of the healthiest countries in the world, but it would only come once we all became aware that our health was at such a low standard.
One of the biggest public health emergencies is substance abuse. The Armstrong, Indiana Clarion Drug and Alcohol Commission focuses on immediate response to those in need, connecting individuals with a support network and appropriate treatment.
The mission of the Armstrong, Indiana Clarion Drug and Alcohol Commission is to address the abuse and destructive effects of alcohol, tobacco, and other drugs. We want to share with you 3 innovative programs that we've started in our county. The first one is the ARMOT program, which stands for the Addiction Recovery Mobile Outreach Team, where we have embedded a full-time case manager and a full-time certified recovery specialist into 2 of our hospitals. Our second program, the 24-hour warm line, was set up in response to our first responders and our hospitals, requesting that we provide a 24/7 resource to them. Our third program, harm reduction, is also very active in our counties in helping the people that aren't ready to go to treatment. We like to be there before, during, and after the recovery process.
Heading to the West Coast now, and Los Angeles County's Department of Public Health, their Division of Chronic Disease and Injury Prevention has 2 specific goals: the cessation of tobacco usage and to identify and support those experiencing food insecurity. In the first of 2 short films, let's look at the Tobacco Control and Prevention Program.
The San Fernando Valley Partnership is a respected and trusted community partner. They are community leaders, community advocate, they are prevention experts.
The work that we do is that we really work on building rapport with retailers to help prevent youth access to alcohol, tobacco, and other drugs. That's the foundation of the work that we do in prevention.
Fresh from this morning's opening general session, Admiral Rachel Levine, Assistant Secretary for Health and Human Services, is here in studio now to discuss what she sees as the biggest public health issues and what are some of our biggest accomplishments thus far. Thank you so much for being here today.
Well, thank you for inviting me. I'm pleased to be here.
So tell us first off, what are some of the biggest issues, facing public health right now?
Well, right now, of course, at Health and Human Services, we're focusing on health equity. Healthy People 2030 defines health equity as the highest attainment of health for all people. And that really informs, under Secretary Javier Becerra, much of our work at HHS. So we are working, for example, on the impacts of climate change on health. With a new Office of Climate Change and Health Equity. We're working on environmental justice. The impacts of long COVID on communities and populations, again, with that health equity lens. Food and nutrition security, and much more.
Are there other issues that you want to tackle or that you think to be really something that we should focus on?
Well, we are absolutely focusing on the impacts of climate change on health. And we have seen that in the United States and around the world. That can be extreme heat. It can be fires with the resulting smoke that we saw for the first time ever in New York City and in Washington, D.C. Sea level rise and storms that are exacerbated by climate change. And of course, the health impacts are with those same vulnerable communities that have health disparities in terms of other issues. So our new Office of Climate Change and Health Equity, with its sister Office of Environmental Justice, is looking at that at HHS and really working across the government. We're going to COP28 in Dubai at the United Arab Emirates to work on this globally as well.
And so as being here at the APHA, Meeting and Expo, is that one of the reasons why you're here, is really to raise awareness about this, but also to collaborate with others?
That's exactly right. So APHA is such a fantastic organization, and its meeting is so large with thousands and thousands of members. It's a great opportunity to collaborate, to talk about these type of ideas. And during the opening session, I talked about a program that we're advancing called People and Places Thriving. people and places thriving. And it really looks at many of the issues we're looking at with a new lens, a new lens of the vital conditions of well-being and justice. And this is something that's across HHS, but actually across the federal government. And I was very pleased to introduce this topic and this program and initiative at APHA today.
So that's amazing that you were able to introduce it here. And I imagine that that's something that, like you said, you're going to focus on, and you want to make that a priority, right?
We do. That is going to be a priority for our office of the Assistant Secretary for Health, but working across HHS.
And so do you have anything you want to say to those that are in the public health sector or those that may watch this? You know, what do they need to know about anything going forward?
Well, the impacts of COVID-19 have been so significant, and the acute impacts of COVID-19. And they have shown us the depth and breadth of the health disparities that exist in our nation, particularly for communities of color, but also for other communities, for example, the LGBTQI+ community. And so, you know, we have to address those health disparities. We have to take this health equity lens. I'm a positive and optimistic person, and I think working together with federal, state, local public health officials, internationally as well, that we can address the challenges that we face now and in the future.
Thank you again so much for being here, and we appreciate it.
My pleasure. Thank you very much.
Now for our second visit to Los Angeles County's Department of Public Health. Let's take a look at the Nutrition and Physical Activity Program.
The focus of our work is to partner with communities across Los Angeles County to help promote healthy eating and active living. And the focus of our work is not just to help families make healthier choices, but to help change environments, systems, and policies to help ensure that everyone has access to healthy, nourishing, and culturally relevant food.
Here at Northeast Valley Health Corporation, we are striving to implement various evidence-based strategies to help increase access to healthy foods for our patients and the communities that we serve.
The Rutgers Equity Alliance for Community Health, or REACH, started in 2021 as a presidential initiative. Starting in 3 nearby communities, REACH is focused on the 5 social determinants of health: education, employment, food access, housing, and population health. Let's see how it works.
I am a firm believer in nothing about us without us. For too often, we have believed we could go into a community and tell people what they need to do without understanding there is enormous wisdom in communities that we too can learn from.
The people who work in the community, see these issues every day, live these issues every day, have to be part of the work to help create long-term solutions.
When I think about REACH and its future, wherever Rutgers is planted, you are going to see healthy and thriving communities. By training up new generations of young people to think about service to community in a new way, to train our own healthcare providers to listen in new ways to the community that they serve. If we keep doing that and iterating it, its reach will expand.
What are some of today's top public health issues and how do we address them? John Auerbach and Sarah DeGia are in studio now with their thoughts. Well, welcome. We're so happy to have you all here.
Nice to be here. Thank you. Good to be here.
So thank you so much for being here and being here and part of APHA TV. Let's talk about, first off, what are your visions for a better public health system? And we'll start with you, John.
Well, I think there are a few characteristics of a better, stronger public health system. One is adequate and sustainable funding. Another is focused on equity and community focused. A third might be making sure that we're doing the work that addresses the major public health issues that is being faced by the public. And then finally, I would say we need to be guided by state-of-the-art data, science, and evidence.
All right, and Sarah, what are your thoughts on this?
Well, some of my issues will be the same as John's, but I would start out with saying that a
better public health system, one, centers equity. And that means that we're bringing community members into decision-making processes. We're partnering with them, elevating their solutions, and resourcing them to be able to be our partners. The second issue I would say is we need to increase our public health law practitioners' knowledge of and confidence in using law and policy to better promote equity. The third issue I would say is that we need to make sure that, just as John mentioned, that our public health systems are resourced to do their jobs to better protect all of our health. And finally, I would say that we need to make sure that our public health departments are fully resourced.
Now, you mentioned several different things that need really attention to. What do you think is the most important one that we need to focus on right now? And Sarah, I'll start with you.
I would say really centering equity. For so long, our communities, BIPOC communities, LGBT communities, women, and other traditionally marginalized communities have not been the center of our policies and our practices. And as a result, while you see some increases in overall public health, you see a widening of health disparities and inequities, particularly amongst those communities that have been traditionally marginalized. And so if we are to see the increase of our health overall, we really need to center the health of those communities in particular. And again, law and policy are really important tools to be able to help us advance equitable systems for change.
Okay, and John, tell us about what your thoughts are.
Well, I agree with everything that Sarah said, and I think I would add to that we need to pay attention to the infrastructure of the public health sector and the workforce of the public health sector. We've just neglected those because there haven't been resources for them. The way that funding has been allocated over the last several years is very much disease-specific or condition-specific, and without regard to how do you have a well-respected and well-supported workforce, and how do you have the wraparound kind of activities you really need in order to make sure that your public health agencies are able to function efficiently. So infrastructure in a sustainable way and lots of attention to supporting the workforce.
So that's important what you're saying as far as involving, it sounds like everybody, almost like wraparound way so that we can, make sure that public health is better in the United States. And, Sarah, you also talked about, law and policy, and how can those really work together, I guess, because you have to have everybody collaborating, right?
Absolutely, and I would endorse 100% that public health really does need to collaborate with other partners, and other partners need to collaborate with public health, because we're dealing with complex challenges and issues. We're dealing with inequities that are deeply embedded and entangled into our system's policies and practices. Public health can't do it alone, and we also need to have those partners at the table to ensure that we're doing it together in order to tackle these big problems and challenges.
And on a positive note, what are we doing that's right? Because I know people want to know about hope, and they want to know about, being positive, and what is actually happening that's, working right now. And that could be John, you want to start?
Well, I would say one thing that I think where we've made real progress is our focus on the importance of equity and the importance of paying attention to the social determinants of health, the social and economic factors that have an influence on public health. That's really become mainstream public health now. And it doesn't mean that we're where we need to be yet. That work is still somewhat fragile, and we need to shore it up at all times. But we're better positioned than we've ever been before to deal with such issues as racism, homophobia, transphobia, and the impact that has on health. So there's reason for hope because of the full embracing of those concerns by the public health sector.
John, thank you again, and also Sarah for joining us here today for this interview on public health. Driven by a commitment to health equity, the Innovation Learning Laboratory for Population Health at Morehouse School of Medicine is at the forefront of healthcare transformation. In their symphony of health innovation, every member and strategic partner plays a crucial role in building a healthier, more equitable future.
Welcome to the heart of groundbreaking healthcare transformation. The Innovation Learning Laboratory for Population Health at Morehouse School of Medicine.
In our quest for health equity, innovation is not an option, it's a necessity.
The HealthWorks project, a capacity and vaccine confidence building project, led to breaking barriers by bringing accessible healthcare to the doorsteps of underserved communities. The CTOR project, an opioid use disorder reduction project, led to the creating of an environment stigma-free to improve the uptake of resources for recovery. Our flagship product, the Community Health Worker Curriculum, continues to be adapted with the assistance of subject matter experts to meet the needs of underserved communities. Each member of the lab and strategic partner plays a crucial role in the Symphony of Health Innovation.
That does it for this second day of APHA TV. Thanks for joining us as we put the spotlight on the growing public health needs in America today and the ways in which we are making significant strides. Remember, you can always go back and watch any portion of today's episode playing on the TVs throughout the Convention Center, on the in-house channels at several of our partner hotels, on the APHA website where you can click through the video playlists to find even more exclusive meeting content, and on our YouTube and X pages formerly known as Twitter. Thanks again for spending time with us today. We are only half through this informative week in Atlanta. We'll see you back here again tomorrow.